Your doctor says your anxiety is just stress. Your therapist suggests more meditation. Your psychiatrist prescribes Zoloft. But what if the real culprit is your hormones? And what if there's a treatment that could change everything without you needing to be on SSRIs? Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Today, we're diving into a question that's keeping millions of women awake at night. Does hormone therapy actually help menopause, anxiety, and depression? Here's what shocked me when I started digging into the research. Up to 70% of women experience mood disturbances during menopause. Nearly 60% report anxiety symptoms. But here's the kicker. Most doctors never mention hormone therapy as a treatment option. Why? Because there's a massive gap between what the science shows and what women are being told. Let me share what happened to Sarah, one of my patients. She came to me after trying 3 different antidepressants. Nothing worked and she felt like she was drowning. But within weeks of starting hormone therapy, she told me, "I feel like myself again." Sarah's not alone. Multiple randomized controlled trials show that hormone therapy can significantly reduce depressive symptoms in perimenopausal women. One meta-analysis found that the average woman on hormone therapy had lower depression levels than 76% of women not receiving treatment. But here's where it gets interesting, and this is something most women don't know. The timing matters more than you think. Research consistently shows hormone therapy works best when started during perimenopause or early menopause, not years later. There's a critical window for maximum benefits. Think of it like this. Your brain is like a garden. Estrogen is the water that keeps everything growing. When estrogen drops suddenly, your mental garden starts to wither. Hormone therapy is like turning the sprinkler system back on. But there's something even more fascinating. Studies show that estrogen protects your brain's ability to make serotonin and regulate stress hormones. It's like having a built-in anxiety shield. Now, I know what you're thinking, but what about the risks? Here's the truth. For many women, especially those under 60, the benefits often outweigh the risks when it comes to mental health. One study followed women for years and found that those who started hormone therapy during perimenopause had significantly lower rates of depression and anxiety. The earlier they started, the better the protection. And here's something that might surprise you. Hormone therapy can actually make antidepressants work better. It's like adding fuel to your existing treatment. However, there's one crucial mistake I often see women make. They wait until they're in crisis before they get help. If you're struggling with menopause-related anxiety or depression, I've created a free guide with practical strategies. You can download it using the link in the description below. When it comes to hormone replacement therapy, here's what the research tells us. Estrogen therapy shows the strongest antidepressive effects compared to progesterone and testosterone. Patches may work faster for some women and have a safer side effect profile, particularly in terms of reducing the risk of blood clots and improving heart health. And starting during perimenopause gives you the best chance of success. But remember, this isn't about replacing traditional mental health treatment. It's about adding another powerful tool to your toolkit. The bottom line is your anxiety and depression during menopause aren't just in your head. They are real biological changes that deserve real science-based solutions. You deserve to feel like yourself again. You deserve to wake up without that crushing weight on your chest. And you deserve doctors who understand that your hormones and your mental health are deeply connected. If you found this helpful, check out this video on the top 5 supplements for menopausal brain health.